Welcome back, West Michigan. I'm Lynda Balkema, and you are watching Alive and Well. And my guest today is Dr. Stephen Zonca, and we are talking about facelifts at this point. And I'm asking him point blank, what can I do with this face? Seriously, I'm 53 years old, and I've had a lot of sun damage, and I've noticed a lot of looseness. I had a hysterectomy a few years back, and I think that I've probably lost some elasticity in my skin. And right here, I want this lifted up, and I also have a lot of surface skin damage that I don't even know that a facelift would take care of the lines. So I'm going to go under his eye and have him tell me.
Well, there's certainly, we were talking about the range of minimally invasive to more invasive. The reality is that the facelift is the gold standard of facial rejuvenation, and that's something that both myself and my partner do perform here. It is typically a hospital-based type procedure or outpatient surgery procedure, and it does involve some incisions and not only removing excess skin but tightening the underlying layers of the facial musculature.
Okay, where would those incisions be made?
They're hidden right in the hairline and right in front of the ear, and it comes in front of the ear and then just behind the ear and back into the hairline. And so it's
in front of the ear too.
Yes,
okay.
And it's a beautiful incision. It's your hairdresser would have to look really hard to find it.
Really? Okay, because I do get chetosis. Is that what they call the pink swelling scars? I do get some of that.
The keloid type scars, maybe?
Keloid, is that what it's called? Keloid, okay. So, but it's a small incision there?
It's right in front of the ear, and it's beautifully hidden.
Beautifully hidden, okay.
With the natural shadowing of your facial skin right there.
Right.
There are other options for facial rejuvenation for someone who either may not be a candidate for surgery like that, including laser. We have laser resurfacing, including fractional treatment, and that's something that's a newer development in facial resurfacing. Again, we talked about facelifts being the gold standard, and really the development of lasers continues to work towards getting facelift type results with a laser type procedure, and every generation of laser that comes out is closer to that. We've had several versions of lasers here, and they keep getting better and better. The latest version that we have, the Cyton laser with fractional treatment, it's a two-phase laser, and the first pass removes the outer layer of skin to remove irregularities and sun damaged skin, and the second laser is very small perforations into the deeper layers of the skin, but at a very low density, between 10 and 20%. And what that does is it causes collagen formation and tightening of the deeper layers of the skin, so that we get a lot of the nice tightening of the skin as well as a resurfacing of the superficial layer. So you get that baby type skin.
Baby type skin. So would it really take care of some of the deeper lines when you do that? Does it
can be
take care
very
of those
effective, for example, around the mouth, where a facelift will not help. A facelift is, a facelift will help what we call the nasolabial folds, which goes from the corner of the nose to the corner of the mouth. A facelift will nicely flatten that out, as well as you've referred to the marionette lines, which go from the corner of the mouth to the chin. That will be significantly improved with a facelift.
Okay.
Where a facelift has limitations are the lips, and so again we would consider a combination of fillers or laser resurfacing around the mouth to optimize.
That's another question I have now. When you're going through all this, I've always wanted fuller lips. Do you have people come in with pictures? I want her lips and I want her nose, and do people do that?
Certainly. We have to work with what we're starting with. We can, with fillers, add volume to the lips, not only the lips themselves, but especially people who've had a history of smoking or have had a lot of weight loss, have vertical lip lines, and as well as loss.
Right up here. I'm not a smoker.
But as well as loss of volume to the lips. And so, again, the fillers that we have, Juvederm is the most commonly used in the lip there, and it's a great filler. It lasts up to a year and can really make a very natural restoration of the lips with just an office-type procedure with minimal downtime.
Is that what they used to call the bee sting? The bee sting to the lips to kind of give the fullness?
Yes.
I mean, I've always just had very thin lips. I'm going to be one of those old ladies that, you know, lose my lips. So I would like to. Can you do that all in one, like one-stop shopping? Could you come in and get the laser done to the face and get the filler done on the lips and, you know, hide from people for a few days and come back out looking fantastic?
Well, there's always recovery time with the, for example, the laser. With the fillers, typically the fillers are, you could go back to work the next day.
Okay.
With those, there might be a little bit of bruising that you would just where the needle went in, and you could cover that up with some cover-up makeup or on the lip lines, a little lipstick. There's always the possibility of some swelling there. Similarly, Botox is, you know, you could go back to work. We have people who come at their lunch hour, get their Botox, and go back to work. It's a short procedure, and the effects are very immediate.
So you're saying that, what is that? How did you phrase that? The gold seal standard?
The gold standard for facial rejuvenation is still a facelift. There's no question about that. That is the what everything else is compared to. That being said, there are a lot of procedures, adjunctive things that we can do, minimally invasive in the office to optimize the appearance.
Optimize, but if you want the full effect, now you talked about the incision being right here and hardly being seen. Now I have seen. Are there other lifts that come up here on the? I don't want that, but I've seen that.
A brow lift is a lift of the forehead.
When they do staples up here in the head,
there can be staples or sutures up in the head, and that's to help elevate the eyebrows with drooping eyebrows. Another procedure we would consider would be removal of excess skin from the upper eyelids or blepharoplasty.
That's pretty common too. You see that. I
is.
think as is it something that comes with age usually, the droopy eyelids?
Absolutely.
But I do know several people that have had the eyelids, both men and women.
And again, it's typically done as a quick outpatient procedure with minimal discomfort. Now there can be some bruising and swelling with that, and so obviously there's some recovery time, but very minimal discomfort with those types of procedures.
Well, and the eyelids is sometimes medically necessary too, because I've seen they come to the point where they interfere with your seeing.
If they are interfering with the vision, that is something that insurance would cover.
Yeah. It'd be great if insurance decides that because we are so emotionally distraught, we look in the mirror, that they would cover a facelift. That would be great. Oh, okay. Well, there's something else I want to touch on. We talked earlier in a show that I did, we were talking about exercise, and as women age, we get something I call wings right here. And I saw on your website that you have some women that have a large, that worry about this area. You also do
arm lifts?
Lifts. Arm lifts and butt lifts. I see that was listed on your site. I guess you can lift anything and everything, but
and we see a large number of the people who've had the bariatric surgery or the massive weight loss surgery have substantial laxity of the upper arms. If it is a mild amount of laxity, that's something where the laser liposuction can reduce some of the volume there and tighten up the skin. Someone, for example, who's lost possibly 100 pounds or more after the bariatric surgery, they're certainly probably going to need more like an excisional procedure to remove that extra skin, and it can be very gratifying for ourselves as well as for the patients. The improvement, patients who've told me that they had a tough time wearing anything but bulky sweater type shirts are now able to wear.
I saw the pictures on your website, and it's amazing. It's really amazing. And any woman, I mean, they deserve. Yeah, you do such a nice job, and what it must do for those people that have it done. I keep referring to women, but I'm sure there's men that have this same problem with the loose skin and need this done. And when we were talking earlier even about the breast reduction, I did see on your site there was one male that you had to do that. And sometimes males are born with an excess amount of, would it be estrogen that causes?
There can be either hormonal imbalances or other factors which can cause breast growth in men, and called gynecomastia, and that's something that we certainly can take care of also. It's a small incision and relatively quick recovery time, and typically done as an outpatient procedure. Does require an anesthetic, but that we can remove that breast tissue for men, and again, it's something that especially young men may be very self-conscious about their appearance.
Say, is there an age requirement for that? I mean, what is the youngest? I mean, because I know that's something that
certainly it's something that we would consider in teenagers in their later teenage years, if it's been present for at least 6 months. Transiently, it can come and go with hormonal changes in teenage years, but for someone it's been there for more than 6 months and it is a moderate amount of tissue, certainly it's reasonable to consider that even in the late teenage years.
Okay, well, wonderful. We're going to take another short break and stay with us because we have one last segment and we want to talk to you more about the laser procedures, and also you have a great line of skincare here. Stay with us, West Michigan.